we do a talk on strength and endurance, and I share with patients that when a person's considering changing lifestyle, they always ask, is it worth it? And so they have to weigh the consequences, the challenge of changing a lifestyle versus the benefits. And one doctor was trying to convince a group of women to stop smoking. And so he's trying to motivate them. And he was talking about lung cancer and heart attacks and strokes and emphysema and all these things that smoking can cause. But they kept chatting in the background, and they didn't look real interested until he said something that caught their attention. They were terrified and motivated. You could hear a pin drop. All the discussion stopped because he just told them that smoking caused wrinkles. And so now they're motivated. We have, by the way, were there any questions from the talks last night or this morning or anything of that nature while we have some time while the others are coming in? Were there any other questions or concerns? One of the things we do also to try to motivate older people, we can show them how it can decrease disease and actually increase lifespan. But and they like to look at Adventists because they have a longer lifespan. In fact, they had one of the blue zones is in Southern California at Loma Linda, where the Adventists, a large group of them live. And they were interviewing these centenarians, and one of them said, one lady, the guy was saying, you don't look 100, why? You don't look 90, you don't look 80, why? You don't even look 70. And she smiled and looked at him and said, keep talking. So she liked that. One fellow said, I'm out to beat the retirement system, and the only way to do that is to keep breathing. So they asked one lady, says, and she's a centenarian, she says, well, what do you do on weekends? She says, well, I get in my car and I go around and I drive all the old people to church. So we also had one incident that these older Adventists can be a real problem. I was covering for my partners one weekend in Oklahoma, Ardmore, Oklahoma, and I was seeing the patients, and one of them was up in the intensive care unit. He was in his 80s. He was a church member at one of our churches. I didn't know him personally, but he was in the intensive care unit. And sometimes they get ICU psychosis, they call it, where they get kind of delirious. And so he starts asking for his mother, says, where's my mother? How's she doing? I said, sir, it's okay. She's waiting for Jesus to come. You get to see her in the resurrection. She says, oh, she died and they didn't tell me. And he was all stressed out about it. And I reassured him, sir, you're going to get to see her. She's resting the race. She'll wait for Jesus to come. And finally, I calmed him down. And then on Monday, his regular doctor came back and said, any problem with the patient? He said, no, just the guy in the intensive care unit. He was a little confused, asking for his mother. And I said, well, she's resting in the grave, waiting for Jesus to come. And he says, no, she's 102. She's in the nursing home. I said, oh, no. So I had to go up and reassure him, mother's okay. So yes, these long-lived Adventists can be a problem. But to motivate young people to make lifestyle changes, I can't tell them about diseases that they get when they get old, because they're never going to get old. They're never going to have these problems, right? They're young teenagers. So for them, I have to talk about strength and endurance. And so I talk to them about how strength and endurance can actually increase on a plant-based diet. And strongest animals on earth are actually vegetarians. Okay, well, at this point, we want to talk about actually the thing that correlates best with improvements in cancer support is fever therapy. getting the immune system to turn on by increasing the body temperature. And we want to look at the evidence we have that this can be helpful and show you also how to do it. So, as a reminder, cancer is on the rise. In 1900, the lifetime risk of cancer was 1 in 40. By the 1940s, it was 1 in 20. Now it's about 1 in 3. And why? Well, I believe dietary changes are the main problem. We've covered this in previous talks. But today we want to look at the powerful immune stimulant called fever. We're going to look at how hyperthermia, which is an artificial way to produce the beneficial effects of fever. We're going to look at a review of history of hyperthermia and the rationale behind what they call fever treatments, which is what hyperthermia is sometimes called. We'll see how it's been used in the past and how it's being used today. So the question, is this approach effective? Well, to answer this, you want to say, well, you're turning on the immune system. Is that the problem? Is a suppressed immune system the problem in cancer? If this is so, then strengthening it and activating it would be a reasonable and effective way to prevent or treat it. Much of the answer to this question comes from a biography of Dr. Dennis Burkitt. From this source, a brief summary of his work with Burkitt's lymphoma follows. Who was he? Well, he grew up in England and in his college years accepted Christ as a personal Savior. He felt called to serve Jesus in Africa as a surgeon under the employment of the government in Africa. In 1957, Dr. Burkitt was shown this 5-year-old boy with a deforming swelling on both sides of his upper jaws. A biopsy showed a small round cell sarcoma, highly malignant form of cancer. He was the first of many such cases he saw. It usually affected children aged 2 to 12, peak incidence around age 8. Could affect the eye, jaw, the abdomen, kidney, bone, or a combination of all. He took safaris all through Africa, visiting hospitals, and plotted the distribution of this lymphoma. He found the geographical distribution was limited to tropical Africa. It was never found in South Africa. He found that it occurred where the temperature stayed above 60 degrees year-round and where the rainfall was 20 inches or more. If either of these were not fulfilled, you didn't get this cancer. This fit the distribution of sleeping sickness, which is a parasitic disease spread by the tsetse fly, yellow fever, a viral disease spread by mosquitoes, yang fever, bane in the bones is another term for it, which is a viral disease spread by the mosquito, and malaria, a parasitic disease spread by the mosquito. In other words, you've got to have the tropical climate to breed the mosquitoes to get the cancer. From this distribution, it appeared that some insect was responsible for inoculating children with a cancer-causing agent. The only agent thought to cause cancer known to be transmitted by mosquitoes were viruses. So they hypothesized that the mosquito was transmitting a virus and that this could cause the cancer. Well, then the question comes up, well, wait a minute, you're telling me a virus can cause cancer? Well, to find out, let's look at the how our understanding of viruses evolved. In developing the anthrax vaccine, Louis Pasteur, he could see the bacteria under the microscope. But when he was developing the rabies vaccine, he could not see any organism under the microscope. And he hypothesized that it must be a microorganism infinitesimally small. Now we know it was the rabies virus. Here's a view of the tobacco leaf disease. How is it transmitted? Well, in 1892, Iwanowski took some of the leaf, ground up with water, passed it through a porcelain filter, you see. By the way, you can still get these porcelain filters at REI. The porcelain filter has holes small enough to exclude red blood cells, white cells, any human cells, any bacteria, but they are not small enough to exclude viruses. So when you pass a fluid through, you're getting rid of all the cells and only allowing viruses to pass through. So he took this ground-up leaf of a tobacco plant with tobacco mosaic disease, ground it up with water, passed it through a filter, put that water on a healthy plant. The healthy plant got the tobacco leaf disease as well, indicating, again, transmission by a virus. Today we call it the tobacco mosaic virus. Now we know that viruses can cause rabies and tobacco leaf disease, but can they cause cancer? Well, in 1898, Cernel Viragrey, he took cancer tissue from myxomas in rabbits. These are benign tumors in rabbits, ground it up with water, passed it through a porcelain filter to get out all the cells, and when he introduced it into healthy wild rabbits, they caused a benign fibroma, but when introduced into domestic rabbits, it caused cancer, a fatal myxoma. In 1908, Elleman and Bang of Copenhagen filtered the blood of a chicken with leukemia. Now, leukemia is a blood cancer where the blood cells are cancerous, reproducing. He passed the blood through a porcelain filter, removed all the cells and all the bacteria. He then injected this fluid into a healthy chicken, and that inoculated chicken got leukemia. Not good news for people that like to eat chicken. 1911, Peyton Roos of the New York Rockefeller Institute took a solid cancerous tumor. Now, this is not a blood cancer, this is a solid tumor, a sarcoma from a chicken, ground it up with water, passed it through a porcelain filter, injected it into healthy fowls, and those fowls got the sarcoma as well. Again, indicating transmission of a cancer through a cell-free filtrate, a virus. All these instances of cancer being transmitted from one animal to another implicated a virus. Were they ever able to see the virus? Well, in 1935, Leninger and Guy took tissue from a Rous sarcoma, a type of solid tumor, ground it up, filtered it through a porcelain filter, put it in a high-speed centrifuge, and then they saw under the microscope tiny 70 millimicron sized particles, which they believed to be the Rous sarcoma virus. It wasn't until 1945 when they developed the electron microscope, and for the first time they could see viruses clearly. And here's a picture of a virus. I'm sure you've seen pictures of viruses. This is an avian flu virus. In 1946, Porter Pickles took the Rous sarcoma cancer cells and examined them with an electron microscope. They saw dense particles, 75 millimicron in size, throughout the cytoplasm. They suspected that this was the virus causing the cancer. Finally, in 1956, Anthony Epstein definitely identified 70 millimicron Rous sarcoma particles as the Rous sarcoma virus. This was definite proof that the Rous sarcoma virus was causing the sarcoma or the cancer in animals. Finally, in 1957, Stewart and Eddy the National Institute of Health propagated a parotid tumor virus in tissue culture, which induced a variety of tumors in the mice, rats, and hamsters. Now, up until 1962, viruses which caused cancer was mainly confined to animals. It was definitely established that viruses could transmit cancer in animals. However, viral transmission of a human cancer had not yet been demonstrated. Many were now racing to be the first to identify viral transmission of a human cancer. With the geographical distribution of Burkitt's lymphoma in the malaria mosquito belt of Africa, it appeared to be the most likely human cancer in the world to be transmitted by a virus, with the mosquito as a vector. Now, there was additional evidence suggesting viral transmission by mosquitoes. What was that? Well, Dr. Burkitt noticed that there were two areas in tropical Africa that had high year-round temperatures, above 60 degrees, and had 20 inches of rainfall or more, but did not have the Burkitt's lymphoma. These were Kinshasa and Zanzibar. And The only reason that they didn't have it was these were the only two areas in tropical Africa that had eradicated malaria through regular mosquito spraying. So you get rid of the mosquitoes, you get rid of the lymphoma. In Uganda, on the equator, he found that where malaria was intense, the lymphoma was intense, and vice versa. There's a direct relationship between the incidence, prevalence, and intensity of malarial infection and the incidence of lymphoma, again suggesting mosquito transmission of a virus. Finally, 1964, Dr. Epstein grew tumor cells from Burkitt's lymphoma. The cells were then examined and found to be full of viral particles, having a herpes viral morphology. It was called the Epstein-Barr virus. You've heard the Epstein-Barr virus before? Okay. They then found that all children with Burkitt's lymphoma had antibodies to Epstein-Barr virus, showing that they had been exposed to the virus. They concluded that the virus caused the cancer. Case closed? Not exactly. They ran into a problem, casting doubt on the whole conclusion. In 1964, they discovered that 85% of all healthy Americans also had antibodies to Epstein-Barr virus, showing they had been exposed to it, but they didn't have the cancer. How could 85% of healthy Americans have been exposed to the virus yet not have Burkitt's lymphoma? Another way of asking it was, if most healthy Americans and Africans harbor the virus, what triggers the cancer? What triggers the virus to produce a cancer in the African? So, while pondering this, they made a fortuitous observation. In 1967, Tony Epstein's young technician, Elaine Hutkin, became ill with a fever, sore throat, and large lymph nodes in the neck. She later got a rash. Her antibody test for Epstein-Barr virus, previously negative, was now positive. They just observed what an acute infection with Epstein-Barr virus looked like. Her physician diagnosed her with infectious mononucleosis. Oh no, now we got a problem. Does Epstein-Barr virus cause mononucleosis, or does it cause the lymphoma, or does it go unnoticed in the majority of Americans and Africans? Yale doctors tested the serum before and after a bout of mononucleosis in college students and found the development of Epstein-Barr virus antibodies in 100% of the patients. Later it was learned that if Epstein-Barr virus is acquired in childhood, it goes unnoticed. If it occurs in teenagehood or in the early 20s, they get mononucleosis. This childhood inoculation accounted for the 85% positive Epstein-Barr viruses patients' prevalence in America. In Africa, they found almost everyone had antibodies to Epstein-Barr virus. So the main question now is, does Epstein-Barr virus cause a mononucleosis, Burkitt's lymphoma, or go unnoticed, as in children in America? Another way to phrase it would be, what triggers the virus to produce Burkitt's lymphoma? Well, the trigger was identified from another observation. Immigrants from tumor-free Rwanda and Burundi, which had no malaria, went into Uganda, which had lots of malaria, and they developed the lymphoma at an older age. Remember, those who usually got the lymphoma at age around 12, these were getting it age over 15, 26% were over the age of 30. This suggested that getting malaria initiated the cancer. How could malaria trigger a virus to produce a cancer? The mechanism appeared to be immunosuppression. The chronic malaria caused immunosuppression, which allowed the virus to grow. People would be fighting the malaria their whole lives. Their whole immune system was now devoted to keeping the malaria under control. They had nothing left to fight the Burkitt's lymphoma virus, and it was able to then progress into a cancer. Is malaria persistent enough in Africa today to cause immunosuppression on a large scale? Actually, yes. Even in the malaria belt, even today, everyone has a low level of malaria. This was illustrated when we took a mission trip to Africa, and my son got malaria. He was 8 or 9 at the time. And so we went, this was in Ghana, in the tropical belt. We went to the local Adventist hospital and got a blood test which showed he had a low level of malaria. And we were told that, well, if he was a native African, we would ignore it because they all have a low level of malaria, but they're immune to it. But your son is not immune to it. We have to give him antibiotics or antiparasitics, or it could be lethal. And so we did, and he recovered. So all Africans had low levels of malaria in the tropical belts, resulting in immunosuppression, which leaves them vulnerable to the lymphoma from Epstein-Barr virus. So then the question is, well, can other forms of immunosuppression lead to cancers? Yes. HIV is the classic viral infection which causes severe immunosuppression by destroying certain T lymphocytes. Can this lead to cancer? Quoting from an internal medicine textbook, HIV-infected individuals have increased propensity to develop malignancy. The occurrence of an unusually high number of cases of the aggressive clinical course of Kaposi sarcoma, which is a type of cancer, was noted early in the AIDS epidemic. AIDS basically destroys your lymphocytes, which is part of your immune system, and in that a weakened immune system, cancers are now more likely to develop. The other case where immunosuppression is known to cause or open the door to cancers, increase the incidence of cancer, is when you receive an organ transplant. We have to intentionally suppress your immune system so you don't attack your transplanted organ, because it looks like a foreign body to your body. So when you suppress the immune system, it increases the risk of malignancy. These are a list of cancers, that incidence of which is increased dramatically when you do immunosuppression intentionally for an organ transplant. So, how to strengthen the immune system? Well, we've talked about phytochemicals and antioxidants to strengthen the immune system. Countries that have high per capita vegetable intake have about half the cancers that we do. T. Colin Campbell showed that a high animal protein diet at 20% or more of your calories can stimulate cancer growth, but the plant protein did not. So we recommend a vegan diet. And there are certain herbs and herbal teas and herbal derivatives that are very helpful, including Easy-Act tea. We also talked about cleansing enemas to help detoxify the body where there are high tumor loads. But tonight I want to focus on the stimulating or turning on of the immune system. We'll see that fever is just such a stimulation, and this is why we use fever therapy. So, do fevers, quote, turn on or stimulate the immune system and thus aid in combating infection and cancers? Well, let's find out. I'm indebted to Matt Kluger, who did much of the research in the 1970s on animal studies and fevers. He wrote, "Today fever is perceived as something that needs to be suppressed, yet historically it was perceived as beneficial." Hippocrates said, "Nature never needs any instruction." He wrote that during an ulcerative eye infection, a fever supervening is a favorable sign. Rufus of Ephesus wrote, "I think that you cannot find another drug which heats in a more penetrating manner than fever. For this reason, it's a good remedy for an individual seized with convulsions, and if there were physicians skillful enough to produce a fever, it would be useless to use any other remedy for the disease." Thomas Sydenham, the 1600s, a famous English physician, also wrote, "Fever is nature's engine which she brings to the field to remove her enemy." But today there is a widespread trend to reduce all fevers with antipyretics. Kluger wrote, "One might surmise from this widespread attempt to reduce fevers that convincing evidence had been presented which demonstrated that fevers were harmful. This is not the case. If anything, the weight of evidence tends to support the opposite conclusion." By the way, when did this perception of fever being harmful occur? Actually, it occurred around the 1950s. And coincidentally, that same change in how we viewed fevers occurred about the same time that aspirin started to be marketed in the United States. In the late 1800s, Louis Pasteur was studying anthrax, trying to develop a vaccine for it. He found that he could inoculate cows and sheep with anthrax and produce the disease and death in animals in a few days. However, he couldn't produce the disease in chickens. He would inject them with anthrax, and the chickens would ignore it. Pasteur wanted to find out why. Then he noticed that chickens' temperatures ran around 104 up to 108 degrees Fahrenheit, while those of cows and sheep ran around 100.4, a little higher than human body temperature. He postulated that the higher febrile temperatures were protective. So to find out, he took a chicken, wired its feet to a screen, put him in a cooling bath, dropped his temperature down to 100.4, like a cow and the sheep, injected him with anthrax, and the chicken developed anthrax and died within 24 hours, just by bringing the temperature down. He took another chicken and cooled him the same way, injected him with anthrax. Chicken started showing anthrax toxicity in a few hours. He took him out, dried him off, warmed him up. The chicken survived. Amazing that a few degrees temperature made the difference between life and death for chickens. Another more striking example of the beneficial effect of higher body temperatures was found in humans. Hippocrates, around 400 BC, described a mysterious progressive paralysis which would leave the victims paralyzed. He observed that in rare cases, a cure or long-lasting remission would occur if the victim acquired an infectious disease accompanied by a high fever. It was suspected that the fever was helping reverse whatever illness was causing the paralysis. It wasn't until 2,000 years later, 1858, that Enzark and Jensen showed that this mysterious progressive paralysis was caused by a spirochete called syphilis. They termed it neurosyphilis. Then it was noted that in 1887, Wagner Jarig, he was a psychiatrist, he was studying neurosyphilis, and in 1887 he noted that in China and India, syphilis was endemic, it was everywhere. But strangely, neurosyphilis was very rare. He wondered why. Then he noted that malaria was rampant there, and he postulated that maybe the fevers from malaria may be protecting the syphilis victims from getting paralysis. So he proposed inoculating neurosyphilis patients with malaria. You can't do that today, but they were able to do it back then. And in 1917, Wagner Jarig tested 9 patients with paralysis from syphilis, injected them with the malarial blood. Results, 3 out of the 9 had practically complete resolution of their symptoms after developing a fever from the malaria, and then they would treat the malaria. This success led to treating thousands of patients with neurosyphilis by giving them malaria. Prior to malarial treatment, only 1% of neurosyphilis patients showed a full remission, but with Wagner Jarig's treatment, they were getting over 30% remission based on a sample size of thousands. Now, this treatment sounded a bit strange. We'd probably call it malpractice today, But someone didn't think so because in 1927 he got the Nobel Prize in Medicine or Physiology for his work with neurosyphilis, treating neurosyphilis with fever therapy in the form of malaria. A more recent test showing the benefits of fever was done in intensive care patients in Australia, New Zealand, and the United Kingdom. When they were diagnosed with an intensive care unit diagnosis of infection, they recorded the peak temperatures over the next 24 hours. What did they find? They found the higher the temperature during those first 24 hours, the lower their mortality. The lowest risk was at a temperature of 102 to 103 degrees Fahrenheit. In patients without infection, however, the high temperature increased mortality because high temperatures drain a person of energy. And if you've got an infection, that drain of energy is worth it because you're putting your energy where it needs to be. But if you don't have an infection, that high temperature just drains you of energy with no benefit. Have other diseases been treated with fever therapy? Yes, actually, typhoid vaccine was used to treat resistant forms of gonorrhea. These produce temperatures of about 104 degrees Fahrenheit. There were some side effects. Sometimes they would get septic shock from it. Needless to say, they don't do that form of hyperthermia either anymore. Polio was also treated successfully with fevers, as per a report from one patient that we knew. His mother and aunt had contracted polio. His mother received fever treatments and recovered. His aunt did not and was left with residual paralysis. Now, there's more recent evidence about describing the beneficial effects of fever from animal studies. In 1970, Matt Kluger did controlled trials to study the effect of fevers in infected animals. His work was summarized in 1984 in the prestigious journal Science. Actually, Dr. Agatha Thrash was the one that gave me this article back then, and I was very impressed with it. So to study fever, Kluger needed an animal whose temperature he could control and change very easily. And so during a boring lecture, it occurred to him, oh, I need the lizard, because the lizard is an ectoderm. Ectoderm, the only way a lizard can change his temperature to raise it is to move into the sunlight. The only way he can cool it is to move into the shade. So he took the D. dorsalis lizard and put him in an aquarium with sand, sun lamp on one side, shade on the other, put little thermocouples in the rectum, which would measure the rectal temperatures, and he watched where they went. And they went between the sun lamp and the shade to maintain a temperature of about 38 degrees Celsius, which is a little bit above human body temperature. Then he infected a group of lizards with Hydrophila bacteria. When they were infected, they migrated to the sun lamp. Their temperature rose to 40 to 42 degrees Celsius. They recovered, then they migrated back to the shadier areas. Temperature dropped to 38 degrees Celsius. Then he said, okay, what if we prevent the lizards from moving to the sun lamp when we infect them? So he kept the different groups of lizards at different temperatures. And see if I got a... What he found was, if he kept the lizards at 42 degrees Celsius, which was the normal fever temperature for a lizard, he had 95% survival right here. But if he dropped it to 40 degrees Celsius by 3 days, about 70% survival. And if he dropped it down to 34 degrees Celsius, they all died by 3 days. Now, I want you to notice something else here. After 3 days, if he kept them at 42 degrees Celsius, some of them died. I thought, now, why did they die now? Because the disease was over. By 3 days, they had cleared the body of the bacteria. Why were they dying? they were dying of exhaustion. At this higher temperature, the metabolism is racing. It's like climbing a mountain. And they were dying of exhaustion for the metabolism racing so much. And this is why God designed us to have a lower body temperature most of the time, but when we need it, we can raise our body temperature through fever. It does require energy, but that energy is needed to turn on the immune system. And as it is needed in the case of these lizards to turn on their immune system. If fevers are therapeutic in lizards, what about giving aspirin to treat a fever? Well, to shed some light on the subject, another group of lizards were infected with Hydrophilobacteria, and they were given an aspirin infusion. Thus, they did not migrate to the warmer climes as the aspirin prevented the thermostat to rise. So the lizards had no desire to go to the higher temperature. Thus, they did not mount a fever, and they died, as shown in the graph. This is if they were given aspirin and they did not migrate, they were afebrile, they did not have a temperature, and by 3 days they all died. On the other hand, if they gave them the aspirin infusion, but deliberately moved them to the sun lamp and raised their temperature, they all lived. So it wasn't the aspirin necessarily killing them, because this group got aspirin also. It was the lack of a fever that the aspirin caused. And, of course, then they had another control group, which no sodium salicylate, no aspirin. They developed fever, and, of course, they all lived as well. Now, goldfish can also mount fevers. I bet you didn't know that. If you infect goldfish with Hydrophilobacteria, they mount a fever. Now, how does a fish mount a fever? I don't know if you've ever jumped into a lake in the summer. The deeper you go, the colder it gets. Well, fish will hang out at a low level of water where the water's cooler. When they get infected, they move to a higher climb of water where the water's warmer. That's their fever. It turns on their immune system, and then when they're better, they go back to a colder climb. If you prevent the fish from going to a higher temperature, you get increased mortality. So at 32.7 degrees Celsius, which is a fever for a fish, they had pretty much 95% survival. But if you kept them down at 25.5 degrees Celsius, by 3 days, only 20% survival. So far, we've been talking about reptiles and fish. What about mammals? A correlative study in 1977 was done. They took ferrets, they infected them with influenza virus by putting it in their nose, and then they did nasal washings of the nasal cavity every 4 hours. And they tested for virus. It's similar to the COVID tests you do at home with the nasal swab. They were doing them to the ferrets. They then recorded the temperature that the ferret generated. Each ferret would generate different temperatures. And they found that the higher the temperature the ferret generated, the sooner they cleared the virus. Another study was done with mice. Newborn mice can't mount a fever, and when you give them Coxsackie B1 virus, it usually kills them. But if they're 8 to 9 days old and you give them Coxsackie virus, they pretty much ignore it. The difference is at 8 to 9 days old, their temperatures are higher and they can mount fevers. In this study, they took newborn mice, infected them with Coxsackie B1 virus, which would be expected to kill them, but instead they incubated them, raised their temperature up to fever temperatures, and they had a much lower mortality and fewer symptoms than the mice kept at 20 to 24 degrees Celsius. Newborn puppies. Canine herpes virus is always fatal if puppies have not received their maternal antibody protection from their mother's milk, if they're newborns. However, in dogs that are 2 weeks old, you give them herpes canine virus, they get a little runny nose, and they ignore it. What's the difference? Again, puppies that are 2 weeks old have higher temperatures and can mount fevers. Newborns cannot. So the next test they did, they took several newborn puppies, inoculated them herpes canine virus, kept them at their normal newborn rectal temperatures, 95 to 98 degrees Celsius. These all died by day 9. Other puppies were inoculated, and they kept them at higher temperatures, rectal temperatures of 101.5 up to 103 degrees Fahrenheit. By day 9, they were all still living. Now, the puppies that were incubated, they whined and they complained. They didn't like the higher temperature, but they all survived. Pathological studies done on the unincubated puppies showed disseminated widespread viral infection everywhere. But the 2 incubated puppies that died later on showed only a few tiny hemorrhages and just a little pulmonary congestion. Much less tissue damage than those that had the lower body temperature. Then they said, well, what about adult dogs? So they took some older dogs in whom temperatures are higher and they can mount fevers. They infected them with herpes canine virus, and then they anesthetized them and put them at different temperatures. They put one group at a lower body temperature, another group at a fever temperature. And when they did autopsies, they found that those that kept normal body temperature those that had, normal rectal temperatures, higher rectal temperatures, the fever temperatures, they couldn't find the virus or tissue damage. But those that had lower body temperatures when they anesthetized them, they had widespread virus and widespread tissue necrosis or damage. Okay. So, what causes a fever anyway? Well, your body actually, God has put in a mechanism to generate a fever. It's already in place, the system, which would give you a clue that maybe fever's there for a good reason, if there's a mechanism to produce it. What they found is that when you get infected with E. coli bacteria, the white cells sense it, and they release interleukin-1. This stimulates the production of prostaglandin E1 and E2, which crosses the blood-brain barrier and goes into the brain, and that stimulates the brain to raise the thermostat in your body. It's raised up to 102, for instance. But because your body is still at 98.6, you feel cold because your body temperature is below your thermostat set point. So you put on a blanket to get warm, you start shivering. It's your body's way of generating heat from muscular contraction, and your body temperature reaches 102. At 102, someone touches you and says, wow, you're burning up. Don't you feel hot? And you'll say, actually, no, I don't feel hot because your temperature has matched your thermostat set point, so you feel comfortable. However, at that higher temperature, your metabolism is racing. It's like climbing a mountain. You're going to be burning oxygen. You're going to be breathing faster. Your heart's going to be racing. It's work to generate a fever. And so you will feel exhausted with the fever. Once the infection is at that higher temperature, white cells move faster, they gobble up bacteria faster, interferons and cytokine production goes up, lymphocyte production goes up, your whole immune system is turned on. Once the infection is cleared, your body resets its thermostat down to 98.6. But you're still at 102. Now you feel hot because your temperature is exceeding your new thermostat set point. So when you feel hot, you throw off the blanket, and your body, to help you, breaks out in a sweat. And that sweat brings your body temperature down to 98.6 again. In the old days, parents, their kids would get a fever. They would watch the fever, and they would wait, and when they saw the sweat on the forehead, they say, the fever's broken, the kid's going to get better. And that was a good sign. How do fevers help fight infections? Well, first question comes to mind is maybe it's the high temperature itself that kills the bacteria. Many bacteria do grow slower at higher temperatures. Some strains of pneumococci are killed outright by temperatures as low as 106 to 107. Rabbits maintain rectal temperatures of about 103, and fevers can reach 107, and the rabbits could kill the pneumococci just by heating the pneumococci up. Remember, fever therapy was used successfully to treat neurosyphilis and resistant forms of gonorrhea. Are the temperatures generated by malaria high enough to kill syphilis and gonorrhea? Well, for gonorrhea, possibly. Gonorrhea is very sensitive to temperature elevations. They're killed outright at temperatures of about 104 to 106. However, direct killing by higher temperatures is unlikely to kill syphilis. Syphilis needs temperatures over 106 to kill it. And malarial fevers don't get that high. So why did the malarial fevers, if the temperature from the malaria fever wasn't killing the syphilis, why were the patients getting better? It would have to be a different mechanism. What we believe is that it's the high temperature that's turning on the immune system, and it's the immune system, not the high temperature, that's killing the syphilis. Can fevers help fight viruses? Well, febrile temperatures can directly inhibit most viruses, polio, for instance. Poliovirus in cultures grows slower at higher temperatures. But the biggest advantage of fever is stimulating the immune system. How does the fever do this? Well, T lymphocytes, this is a picture of a T lymphocyte. It's a white blood cell with antiviral, anti-tumor properties. It can help fight cancers. When an infection occurs, fevers work to enhance T lymphocyte activation and proliferation in order to fight the virus or tumor. Studies by Gordon Duff and Scott Durham at Yale show that the T cell production rate increases 20 times when your temperature goes from 98.6 up to 102 degrees Fahrenheit. Also, the lymphocytes are better able to fight viruses at that higher temperature. This is an interferon. These are proteins which also have anti-tumor and antiviral and antibacterial actions. When the temperature raises from 102 to 104, interferon becomes more than 3 times as effective in fighting a virus in tissue culture. And interferon production increases dramatically as well. This yellow object is a phagocyte, and this orange thing is an anthrax bacteria. Here, a phagocyte is gobbling up an anthrax bacteria. It's called phagocytosis. At higher temperatures, these white cells move faster, they gobble up bacteria faster, and they destroy the bacteria faster once it's engulfed at that higher temperature. Now, many bacteria need iron to live and grow. At higher temperatures, the bacteria's cytophore system, it's a system which allows them to transport iron into the bacteria is compromised. They can't get the iron they need at that higher temperature. Also, at that higher temperatures, the white cells release a substance that binds the free iron in the serum to make it unavailable to the bacteria. So the iron level drops. We have a term in medicine, it's called the anemia of chronic disease. The anemia being that the serum iron level drops if you have chronic inflammation. And it's by design because the body's, with inflammation, is trying to do everything to kill a bacteria, and lowering the iron level is one way of doing it. The desert iguanas, when they're infected with Hydrophila bacteria, their temperature rises and their iron level drops by this mechanism, and that helps them fight the Hydrophila bacteria. Rabbits are found to do the same thing, drop their serum iron. Now, a review noted the beneficial effect of viruses. This is a more current review, and it's indicating that at higher than physiologic temperatures, that means febrile temperatures, binding a bivalent antibody can neutralize pycnoviruses by reversibly neutralizing the virus through disruption of the virion, which leads to ejection of RNA. So ignore what I just said. What you want is fever enhances this process in vivo, confirming the popular belief in the virtues of fever. They're acknowledging that higher temperatures help you fight viruses, and they actually give the mechanism by which it occurs. The review continues. A rise in temperature during fever establishes a cascade of defense mechanisms that increase the host survival and induces T cell proliferation. Remember, T cells are your soldier cells that fight cancers, and differentiation, secretion of interferons. Interferons have anti-cancer effects as well. Increases antibodies and neutrophil migration. The white cells move faster to gobble up bacteria faster. So is hyperthermia useful in viral and bacterial infections? Well, we see that it is. Is it also useful in cancer? Well, there's evidence that it is. In 2001, a review of studies examining the relationship between fever in childhood and decreased risk of cancer was done, and they concluded that, it says, the data reviewed in this article support earlier observations on the topic that the occurrence of fever in childhood and or adulthood may protect against later onset of malignant disease. How did they come to that conclusion, that a fever in childhood could help protect you against cancer later on? Well, they noted this. Clinical oncologists repeatedly report that cancer patients stress in their history that they were never ill before the onset of cancer. As a result of this observation, a number of epidemiological studies were conducted in 1894, and they list a whole list of studies that showed a relationship between fever in childhood and low risk of cancer later, or the reverse, that if you didn't get a fever in childhood, you had a higher risk of cancer later on. These are 10 studies showing a high association between getting a fever in childhood and a lower risk of cancer. This is the only study that showed no association. What can explain this association? Well, one hypothesis, and it's just that as a hypothesis, is that a fever in childhood exercises your immune system and helps it get stronger and more vigorous, so that when you get exposed to cancer later on, you're better able to fight it and get rid of it. Kind of like walking. If you don't use your leg muscles as a kid, it makes it harder for you to walk later on as an adult. We need to exercise those immune system features to help them get stronger. Then they made another interesting observation, that spontaneous remissions are often preceded by a feverish infection. Now, what's a spontaneous remission? That's if you have cancer and all of a sudden you get better for no apparent reason. They call that a spontaneous remission. And they said these spontaneous remissions are often preceded by a fever. This is the article. Spontaneous remissions during or following feverish infections have been reported previously at the beginning of the 19th century. There are several older reports of spontaneous remissions, as well as studies by, and they give a whole list of authors that have reported the association between a fever followed by a spontaneous remission. He additionally notes, febrile infections have been shown to increase survival expectancy in cancer patients. So if a cancer patient gets a fever for another reason, they actually do better. Had a surgeon who did a lot of surgeries for breast cancer, and he said, yeah, there was an article that came out that if we do a lumpectomy, and if the woman gets a post-operative infection at the site of surgery, they have a lower risk of cancer recurrence than if they don't. But then he said, but we don't want them to get an infection, of course, because that looks bad on their surgical record. But the fact that you develop an infection turned on the immune system, and that immune system then helped fight the cancer. Trian and Brotman, they found that, that post-transfusional hepatitis is a common complication in patients with acute myelogenous leukemia, one that actually prolongs survival. What they're saying is if you have a leukemia, you aren't able to produce red cells, and so we give you a transfusion. But if we give you the transfusion back then, you were at risk of getting a viral hepatitis. And when you got the viral hepatitis, your body would mount an immune response to it, and that immune response would actually also help treat the cancer, and they lived longer than if they didn't get the viral infection. Finally, in a recent monograph of spontaneous remissions of malignant melanoma, he listed 21 cases in the world literature in which febrile infections have been associated with spontaneous regression of metastatic melanoma. These are some of the many references reporting infection and or fever in association with spontaneous remissions of neoplastic or cancerous diseases. It's a whole list of them. Bone tumors, Burkitt's lymphoma, brain tumors, you get a whole list of studies. And this is where the concept that what if we induce a fever artificially to produce the same benefit? This is where it comes from, or at least one source of where it comes from. An analysis of the literature reveals that feverish infection is associated with remission in 22% of the leukemia patients that resolved, 15% of cancers of the bone and connective tissue, 11% of the melanoma cases, 7% of lymphoma cases. These authors concluded that the connection of febrile infection and tumor aggression is the most frequent association found in the literature. So, then, what about inducing a fever to produce a remission? Pyrogenic substances, that's a substance that will induce a fever, and the more recent use of whole body hyperthermia, that's where we don't inject it, but we put you in a hot water bath, to mimic the physiologic response to fever, have successfully been administered in palliative and curative treatment protocols for metastatic cancer. That's a quote from this review. How did they come to that conclusion? Well, the review goes back to the first use of fever therapy for cancer. Dr. William Cooley, his career 1890 to 1936, the leading bone surgeon at Memorial Sloan Kettering Center, cancer center of his time, is now called the father of modern immunotherapy. Early in his career, Cooley witnessed a spontaneous remission of a large lymphosarcoma of the head and neck in a patient following a massive streptococcal-induced erysipelas infection. He subsequently deliberately exposed his cancer patients to heat-inactivated cultures of Streptococcus pyogenes and Serratia marcescens. With this treatment approach and the staging methods of his time, Cooley achieved a cure rate of approximately 10%, which at that time was unsurpassed in the treatment of advanced cancer. Fever therapy has had some success as an anti-tumor agent, according to several authors, Cavalier, Sweet, Overgaard. For over 100 years, there's been a link between high temperatures and tumor regression, and it has been noted in the medical literature. I believe the most important role of febrile temperatures in cancer is the ability to stimulate the immune system, as noted earlier. So that brings us to the next question. Is hyperthermia being used today to treat cancers? Well, there are two types of hyperthermia. Local hyperthermia heats up just the tumor, leaving the rest of the body at normal temperature. This simulates, like if you get an infection in your skin, if you put heat on it, it can come to a head faster because you're stimulating the immune response locally. This can be useful if you have a cancer that has not spread yet, if you want to just heat up the tumor locally. This has been done in Germany with and without chemotherapy, and in the US, it's used only as an adjunct to chemotherapy. The other form of hyperthermia is not where you just heat up the tumor locally, you heat up the whole body. This is whole body hyperthermia. And that's where you put them in a water bath and bring the temperature up. This simulates an infection causing a fever. This is done commonly in Germany. They do this, it's regular standard treatment there. And it's used as a standalone treatment for cancer in Germany. In the US, it's being tested as an adjunct, only as an adjunct. You add it to chemotherapy. How is local hyperthermia done? You know, they say, well, you got a tumor in the center of your body here. How are we going to heat that up without heating the rest of you up? They do it with microwaves. This is done in what they call a BSD unit. The BSD 2003 DMR uses an MRI to first locate the tumor, and then it focuses microwaves to heat the tumor up deep within the body. The MRI can then measure the temperature increase at the tumor site. You can actually tell how hot the tumor's getting. Here's what the actual unit looks like. Is it effective? Yes. In an interview with in CBS, Dr. Mark W. Dewhurst of Duke University, he said that applying localized heat deep within the body tumors allows more chemotherapy to reach it. It improves the damage done by chemotherapy and radiation. And he related that 8 to 10 randomized studies have shown that this localized heat improves response to radiation in head and neck tumors, glioblastomas, melanomas, locally advanced cervical cancer, local recurrences of breast cancer, and esophageal cancer. It's also being used in Germany at the Charité Hospital in Berlin. Local heat is applied to deep tumors and increases response to radiation and chemotherapy. At the Charité Hospital in Germany, Dr. Peter Wuss said that research indicate that when you heat the tumor up locally, it doubles 5-year survival time compared to whatever else you're doing for the cancer. China, it's being used in China quite a lot. They've done a lot of research with it. And when they looked at, for instance, 60 patients with non-small cell cancer, lung cancer, had local hyperthermia added to their chemotherapy. Adding localized hyperthermia increased the complete remission rate from 37% to 63%. It essentially doubled the response rate by simply adding this heat treatment to chemotherapy. Head and neck cancer. Stage 4 head and neck cancer, adding hyperthermia to radiation improved tumor disappearances rate from 41% to 83%. Again, doubled the response rate. It improved local relapse survival, improved local relapse-free survival from 24% to 68%, It improved 5-year survival from 0 to 53%, a dramatic increase in survival, just by adding heat, local heat, to the tumor. Another study with pancreatic cancer, they don't do 5-year survivals with pancreatic cancer because hardly anyone lives 5 years. They do 2-year survivals. In the Verona study, adding hyperthermia to the standard treatment increased survival at 24 months from 19% to 36%. Again, doubling survival rate. In Kyoto, Japan, adding local hyperthermia increased 1-year survival from 30% to 49%. Now, when I went on this BSD website, there were numerous articles. I couldn't download them all. I just gave you a few samples, but there were many studies done showing the dramatic improvement in survival. Because of this evidence, Cancer Treatment Centers of America has started using the BSD units in the year 2007. They add this to the chemotherapy or other agents that are commonly used for cancer. However, is whole body hyperthermia being used today? Now, we were talking about local heat. Now we're talking about heating up the whole body. In Germany, it's used as whole body hyperthermia as a standalone treatment for cancer. And they've used it for years. They actually have written into their constitution, like we have in our constitution, freedom of religion. In their constitution, they have freedom of medical practice. You can't prevent someone from using an alternative method of treatment in Germany, and that's why it's kind of a mecca for, if you want alternative treatment, go to Germany. In 1995, they were using hyperthermia in Germany on previously treated, well, they took 103 patients previously treated with all conventional treatments. They were in a stage of uncontrollable progression with metastasis distantly. They used infrared lamps to get temperatures up to about 107.6 under general anesthesia. To get up to 107.6, you got to anesthetize the patient because they can't tolerate it. 50% had a positive response to the therapy. However, there can be toxic effects at this high temperature. Here's what they found in another study. In this study, they took 27 patients that were treated with whole body hyperthermia alone or in combination with chemotherapy and radiotherapy. So to help heating up the whole body. Whole body hyperthermia was performed in a pumped Siemens cabin with hot air and warm water mattresses and a patient being covered in a plastic film to avoid cooling by perspiration. The heat treatment lasted 2 hours and it got up to 107.2 to 107.6 degrees Fahrenheit. And it was done under general anesthesia. Toxicity, such as liver damage, respiratory problems, was considerable. There were 2 fatalities. Hyperthermia gave an improved therapeutic effect in 6 of the patients. Considerable pain relief was observed in 8 out of the 10 patients. Whole body hyperthermia at 42 degrees can be effective, but the potential toxicity limits its use to those patients with severe complaints for whom no other palliative treatment is available. Basically, they're saying if you survived the hyperthermia, you did much better, but you could die from the hyperthermia. This is because they were shooting for temperatures very high, 107. The reason they were shooting for 107 was because they believed the mechanism by which hyperthermia worked was that the temperature itself was killing the cancer cells. Today we understand that's not how fevers kill cancer cells. That you don't have to get up to 107 because that's where you would need it to kill cancer cells. The way hyperthermia works is it turns on the immune system, and you don't need 107 to turn on the immune system. You only need a rectal temperature of 104, which translates to an oral temperature of 103, or an axillary temperature of 102. That is now the target range for alternative practice for fever therapy for people with cancer. And at that rate, you don't have the toxic effects you have at the much higher temperatures. Does that make sense? In America, the only place I know of that we're experimenting with hyperthermia was Houston at Memorial Hermann Hospital. Dr. Bull, as an adjunct to chemotherapy, did anesthesia and hyperthermia together. And they showed significant effects, beneficial effects. In an interview, Dr. Bull said that applying total body hyperthermia in a patient is placed under general sedation, and the vital signs are monitored. The body is then heated up to 104 degrees Fahrenheit. 104 degrees is a rectal for 6 hours as an adjunct to chemotherapy. The patient described in the interview had lung cancer, and the tumor had responded to the treatment with a decrease in size. Whole body hyperthermia is important to help treat distant metastases. How do they do whole body hyperthermia in Germany? Actually, I got a chance to find out. Interesting turn of events. We had I don't know if any of you are familiar with David Asherit. Well, the lady he was an evangelist in Adventism circles, but the lady that ran the health food store that helped bring him into the church, her brother had been into drugs as a kid, but then came out of the drugs, gave his heart to the Lord, became an active Adventist, and was sharing literature with anybody he could see. He had an interesting way of sharing religious DVDs. He would go into a Walmart and see someone looking over the DVD section at Walmart, and he'd say, "Seen any good DVDs lately?" And the guy said, "Nah, they're all junk." And then he'd say, "Well, I feel impressed you'd like this DVD." And then he would give him these DVDs. And because he was so active, we just let him stay in Oklahoma in a mother-in-law's suite or little house attached behind our house. We never charged him any rent, and he had his window washing business, and he's doing fine. Well, then we moved away. We eventually came out here. He moved off to California. We didn't hear from him for about a year or two, and then we found out that he had married a Chinese businesswoman, multimillionaire, and she had breast cancer, so she wanted to fly her over to Germany to see, get treatment there. And he said, "Dave, I want to fly you out, show you what they're doing out here." And I said, "Sure, that's great." So I said, it pays to be nice to people. So he flew me out there, and what I saw, they laid her out on a table with a curtain around it, infrared lamps on her. She got up to 102, 104 rectal, and I said, "Are you uncomfortable?" And she said, "No." And I was kind of shocked, because if we do water baths at that temperature, they are uncomfortable. But what happens is the infrared penetrates, goes about 2 inches into this tissue, heats you up from the inside out. And in Germany, they have a filter, a water filter, that filters out the ultraviolet light and prevents that irritation, that heat on the surface of the skin. And she felt fine. And I thought, wow, if we could get one of these in America. The problem is FDA has not approved them in America yet, so we can't get them. You can do regular infrared, but it causes the same discomfort. It causes discomfort that the water baths cause as well. And so I keep checking on it. I'm waiting for them to approve it, so maybe we can get one out here. We have a treatment protocol, how to do fever baths, fever treatments. It's in our cancer manual. But essentially, you use water at about 110 to 112 degrees Fahrenheit. You get in the water, and it raises your temperature up. And when you hit 102, that's where you start the stopwatch. Try to maintain it for 20 minutes. Then when they get out, you wrap them up in blankets, lay them out. They rest. They're exhausted usually. Try to keep them warm for another 40 minutes. You monitor their oxygen saturation because at that higher temperature, the metabolism is racing. Their oxygen saturation, which normally should be 96 or higher %, may drop even below 90. They can become delirious, and for those patients, we give oxygen. Nasal cannula can maintain their oxygen saturation higher. For people that are inactive, this is a significant risk, but we can eliminate the risk with just nasal cannula oxygen. We had one, well, typically what happens, if it drops without oxygen, they may become delirious, start confessing their sins, they're getting ready to die, essentially. I thought, really, I heard this, but I didn't believe it until I actually saw it. It was a person that was somewhat inactive. However, she had a friend who ran every day. She had breast cancer, and she was doing the fever treatments. And when she got her temperature up, she said, oh, this is nice, and she started reading a book because her system was used to that higher metabolic rate, and she had adapted to it. If there's any reason for a person not to start an exercise program, because of a heart condition or something like that, they should avoid cancer treatments. Also, if a person is cachectic being the cancer, well, let me explain what happens in cachexia. They should not have fever therapy until their nutritional status gets higher. What is cachexia? Cancer cells cannot burn sugar effectively. They can't use oxygen to burn it. They use a fermentation cycle. And so they need 18 times more sugar to stay alive than a healthy cell. So they are sucking up all the sugar. If you have a significant tumor load, that tumor is sucking up all your energy, and you can become cachectic and very weak. Those patients, if you stress them out with a fever bath, they just don't have the energy to handle that higher metabolic rate. So you have to wait for them possibly till they get stronger to do this. So those are some downsides of fever therapy. However, in most patients that can handle it, it's something that we train people to do if they can handle it. In an office setting, we can show them how to do that and continue it at home in their bathtubs at home. Usually they will need a helper to administer it to them. That's it for fever therapy. Thank you for listening. Now, those that need to go, that's fine. Those that want to stay around for questions, yeah, we can field some questions. Let me get them. Thank you. Yeah.
Say prayer real fast.
Okay.
We just want to say prayer real fast. We'd like to
Yeah.
thank you, Dr. Emerson, for coming.
My pleasure.
Sharing all this, and you and your wife, and spending time with us. So we just appreciate that greatly. So
Enjoyed it. Thank you.
bow your heads. Dear gracious Heavenly Father, thank you so much for this Sabbath day. Thank you for the information that's been shared with us. How exciting it is that you've already created these things within our bodies to handle what has been thrown at us. We ask for safe travel and mercies today as we go our separate ways, and we thank you for Dr. Emerson and his wife and their ministry that they're giving to all of us. And we pray all these things in your name. Amen.
Amen. Okay, those who want to stay by, you're welcome. Was there a question over here, or you had a question? Yes.
So is it a one-time treatment, or is it?
What's that?
Is it a one-time treatment, or it can last months?
No. We usually do it. You can do it as often as 2 or 3 times a week. But again, it's exhausting. So depending on the patient's cardiovascular fitness, if they're kind of a weak individual, they may only be able to handle it once a week. But if they're more physically fit and they can have the energy to do it, we can do it every other day.
Alternate with cold baths?
With cold packs? You can do ice to the forehead, and that usually gets them more comfortable. But again, the idea is to try to get the rest of the body temperature up. So, yes, ma'am.
Do you do this in Virginia?
What?
Do you do this fever treatment in Virginia at that?
At Hartland. Yeah, we do it at Hartland Lifestyle Center. Yeah, that's standard treatment if they can handle that, right. We give intravenous vitamin C there, and we also do it up in our office in Frederick, Maryland.
Can
So,
one come just for, say, an IVC?
yeah, if you're,
Or,
if,
you're in relatively good condition?
at Hartland Institute, they want to just treat patients that have gone through the lifestyle program. Now, if they've gone through the program and they live close enough to where they can keep coming, they can keep coming and get fever treatments as long as they want to keep coming. You have to check them for prices and all and arrangements. But typically they want to, what they don't want to do and what we don't want to do is we don't want to be treating someone with just fever treatments and their diet's a mess, they're using alcohol, they're smoking, we want them to have the whole program. And that's why when they come through a lifestyle session, they get introduced to the whole program, increase their chance of success, and then if they live locally, we can continue giving them the fever treatments, we can continue giving them the IV vitamin C as an outpatient, and that's how it works.
And the program is what, 3 weeks?
The current session is 11 days, but for stage 3 and 4 cancers, I've told them we need more time. So right now, if you do stage 3 or 4, you would do 2 11-day sessions back to back with, usually it's a week and a half in between. But after the first of the year, my understanding, we're going to try to go to 17 days. With intravenous vitamin C, we have to start at a low dose, and every 3 days we increase the dose. So that gives us enough time to get to the target dose and make sure there's no bad side effects. And then once that's achieved, they can do it as an outpatient, or they can even do it, in California, to find someplace out there that can give it to them.
Do you use hyperbaric oxygen also there?
We don't have that yet. We would like to get it. We have a guy that was considering donating one until he found out they cost like $70,000 to $80,000. So they're kind of, she asked about hyperbaric treatments. There's the home treatment, which is, I don't know, $1,500, a couple $1,000, and that just puts oxygen in a chamber, in a tent kind of thing, but the pressures only get up to maybe 1.3 atmospheres or so. We were doing it near Denver, which is a mile high, and because it's a mile high, the atmospheric pressure is low. It's about, I don't know, 0.7 or something, or 0.8. And so when we gave hyperbaric there, it only brought it up to about 1 atmosphere, which is what you could get if they drove down to the ocean. So to get medical grade hyperthermia, it's a much more expensive unit. It's about 20. But it's supposed to have good effects. There are places that do it.
Last
Yeah.
question.
Yeah.
Do the patients live on site?
It's a live-in program for 11 days there, yeah. And they live on site. Yeah, they have a place so they can stay.
Thank you.
Yeah. Really good questions. Any other questions? You have a question, ma'am?
You mentioned that there is a mechanism of producing less iron
Yes.
to fight regular infections, or just salmonella you mentioned?
Bacterial infections, not really cancer that we know of. The bacteria use iron, and they get it from your bloodstream. And so your body turns down the free iron that's in the bloodstream so the bacteria can't use it. That's all. It's harmless.
I know.
Oh.
I just had low iron since puberty,
Oh,
and I can't correlate with any infection.
yeah. You can,
You
number
eat
one,
a bacteria and not even know it.
you get an inflammatory marker, a CRP level, and that will tell you your inflammatory state. If it's elevated, then inflammation can be the cause. However, with men and women, we worry about colon cancer because that can cause it. With women, heavy menses can also cause it. And those are things that, you can have checked for. But yeah, that's one option. Yes, ma'am.
Any idea of how would you treat sarcoidosis?
Sarcoidosis is, they don't know what causes sarcoidosis. They believe it may be an autoimmune disease. If it's an autoimmune disease, it should respond to a protocol by Brooke Goldner. I'd have to double check on that. But Brooke Goldner, she's a lady who's promoting blenderized vegetable juices for autoimmune diseases. How she got interested in it, as a child she was diagnosed with lupus, which is an autoimmune disease which attacks multiple organs in the system. And it flared up. Her immune system was killing the organs. They had to give her high doses of corticosteroids to shut her immune system down for her to survive. That's always risky because it opens you up to other infections. But she survived. She went to medical school, got another flare-up, another dose of corticosteroids, barely survived that. Residency, another flare-up, another set of corticosteroids, survived that. Then a Hollywood trainer wanted to marry her. And she said, well, I've only got a few years to live. He says, I want to marry you anyway. She says, oh, okay, well, I want to lose weight for the wedding. Can you put me on your program to lose weight? Well, he was a Hollywood trainer, and what would happen is vocalists who were overweight, when they wanted to go on the screen, as a vocalist, it didn't matter if they were overweight. But when they went on screen, they had to lose the weight. So they would go see him. He would put them on a blenderized solution of green leafy vegetables. Fill it up 3/4 of the way full, green leafy vegetables. Use soy milk or almond milk. The top quarter was fruit. He would whiz it in a blender, and they would drink that through the day. He would use that to increase the metabolic rate. And for bodybuilders, it helped them gain muscle mass. For people wanting to lose weight, for people that had trouble losing weight with just an exercise program, that started dropping their weight. So he put her on that program. She lost the weight. They got married. A year later, she reestablished care with a local physician who got her lab results back and said, I thought you had lupus. She says, I do. He says, well, your lab tests don't show it. So it had basically resolved her autoimmune disease, and she then went on to treat other lupus patients with the same protocol, and she wrote a book called Goodbye Lupus. You can get that on Amazon by Brooke Goldner. It's a short book, tells her life story, and gives you some smoothie recipes. Then she tried using it on other autoimmune diseases, rheumatoid arthritis, Hashimoto's thyroiditis, Sjogren's disease, and had good results with that as well. So she wrote a second book called Goodbye Autoimmune Diseases, where she gives case reports of these different autoimmune diseases. And then she wrote a third book, which is just green smoothie recipes she uses to do this. Her protocol isn't as intensive as Gerson's therapy because you're using the fiber and the greens together. But it's a lot cheaper, it's a lot simpler, because all you have to have is a blender, and you can blend them up quickly and easily. It's a lot less work than pressed juice. But again, it would only be probably appropriate for autoimmune. You wouldn't want to use it for cancers. That's all. You want the more aggressive approach. We've just started advocating that with autoimmune diseases, so I haven't personally seen responses, but that's what we're using now. So these are good questions. Yeah. Any other questions? Okay. Fever baths?
Yes, you spoke to fever bath.
Let me see if I can get closer. I can hear you.
20 minutes to bring your temperature up.
What's that?
I did the fever bath you talked about.
Yeah.
2 degrees, target temperature, is it a one-time event, or is it ongoing over a period of weeks or days?
Well, you shoot for the 102 axillary temperature when you're in the bath. Once you hit that, you try to maintain it at 102 or higher for 20 minutes. Then you get out of the bath, try to keep you warm for another 40 minutes, and then you're done. If you want to do another one, then you do the same process, and it's the same 102 temperature. You can do them as often as a person has the cardiovasculature fitness to do it. Like I said, it's like running a race. And
Is it a one-day event? Is it one day, or is it over a period of weeks?
We do it, well, if a patient can handle it, if a patient has stage 3 or stage 4 cancer, we do it 2 or 3 times a week for 6 months or until we see a response from the cancer. In other words, until we see the cancer evidence that it's responding and going away. And then we would like to do it until it's completely gone away. And at that point, you could cut back to once a week, once a month. We have one lady, she had ovarian cancer. She had surgery, but she had Mets. She did chemotherapy. She did IV vitamin C first for about 2 months. MRIs, CAT scans didn't show any evidence of any metastasis anywhere from that. She went on to do chemotherapy, and it really kind of, it did what chemotherapy does, kind of makes you feel bad. And she survived that, and then, but now we're doing fever baths like once a week. We may do it for another couple months. And then after that, she would be getting, a CAT scan maybe every 6 months to look for Mets, or even a PET scan. If there's evidence that it's come back or returned, then we would start the process again.
Case by case.
Yeah, you have to keep following it. Yeah.
I mean, early onset, obviously, it would probably, results would be quicker, I would think. Response would be quicker.
Actually, we found that the sicker a patient is, the more dramatic response we get initially. For instance, prostate cancers, we had one patient who, he was lifting, he was a Marine, I think he was a SEAL at one point, tough guy, but he's older now. He was working at Amazon, lifted a box, and his back went out. Went to the ER, had a compression fracture of his T-spine, but they also said, but you've got cancer in your spine. It's metastasized there. And they did a PSA level, prostate-specific antigen, which is a marker for prostate cancer. It should be, 4 or less. His was 900. And so we did the IV vitamin C mainly. We did some fever baths for him as well. And in like 6 months, it came down, it was about 6 weeks, probably 6 to 12 weeks, it came down to 26. It dropped dramatically. But once it gets down close to normal, it slows. The response seems to slow down. And to go from 900 to 26 is a big jump, but that happened fairly quickly. Going from 26 down to normal seemed to be very slow. So, and I don't know the explanation for that, but that's what we see.
Well, we're all genetically predisposed.
Yeah, maybe so, yeah. Yeah, good questions. Any other questions? Yes, sir.
There's another question back here.
Oh, sorry, yeah. Who's got the question?
Could you describe the process of a fever treatment? You describe the process.
How we do it?
Yes, because you kind of slid over the
Okay.
importance of keeping the head cold.
Yeah, okay. He's asking a little more detail on how we do it. First thing we do is we want to make sure the patient has a good cardiovascular system, Can they walk up a hill? Can they exert themselves? Because the fever bath will cause them to exert themselves. So make sure they're not cachectic, losing muscle mass because the cancer is just overwhelming, and make sure you don't have a heart or lung issue. That's number one. Then we fill up the water bath to 110 to 112. That's about as hot as you can get without scorching yourself. We usually, our place, we got a big water tank. We turn up the temperature to about 130, 140 the night before. Now, you don't give them 130, 140, but that gets the water hot enough so that when you're in the bathtub, you can adjust the hot and the cold together to get you the temperature you want. And it will, once you get it, you use a thermometer, big thermometer, and you keep it in the bathtub. And when you get 110 to 112, that's your goal. Now, if you have a fiberglass bathtub, that tends to keep the heat better than a steel bathtub. Steel is metal, and it'll pull the heat away a little bit faster. The temperature, no matter what kind of bathtub you use, will cool down with time, 5 to 10 minutes. To get the temperature up again, my wife will have an electric tea kettle. You put a couple quarts of water in, boil the water, put it down at the feet of the patient, and swish the water in so you don't burn the patient. You kind of move around like this, and you pour the water in, and that keeps the water temperature up. Then the person, usually get in the bathing suit or something, they lower themselves into the water, head up. Their knees can be out. If you have a standard bathtub, works just fine. Their knees might even be out of the water, and that's okay too. Usually water's up to the neck. And then we usually use an oral thermometer, and we just check the thermometer temperature every 5 minutes or so. We have a little pulse oximeter, which monitors their oxygen saturation. We want to keep it above 90. And it will also tell you the heart rate. Generally speaking, we try to keep the heart rate below 130 or less. If it jumps up very high or the oxygen saturation goes too low, we say, okay, we maybe need to cool them down. So we might either pull them out, drain some water out, add some colder water, whatever it takes. If the oxygen saturation is dropping, we can also do oxygen. We have an oxygen concentrator. That's very helpful. I think, I'm not sure of this, I think you can buy them at a medical supply store. You're not going to get a Medicare to pay for it, of course. You have to pay for it out of pocket. But those are good to have on hand. Generally, what we like to do is for a patient to do the first 2 or 3 in our office where we're experienced doing it to see how they tolerate it. At our home, we do a 3-day intensive, and during those 3 days, we train someone to do the fever baths. So the first time we have the patient and the helper come, the helper watches, my wife does it. Then on day 2, my wife does the fever therapy for them, but the helper helps with doing things. And then the third time, we have the helper do the fever therapy, and my wife helps and observes so that they get comfortable, and we see, do they need oxygen or not? The majority of patients do not need oxygen. Only a few we found, but it's nice to pick those up early. And so that's a simple way to do it. On the other hand, you can test it yourself. You can do this. You might want to get, if the patient is old and feeble or weak, you may want to get a clearance from a doctor saying, they're good to have a moderate exercise program, something of this nature. So we watch, we monitor body temperature, oxygen saturation, and heart rate every 5 minutes. And when the temperature hits, oral temperature actually should be maybe, ideal would be 103. we start the stopwatch. And then if they feel uncomfortable, we can ice to the forehead. We can give them water to drink. I should add one thing. When you are in hot water, your blood vessels dilate, your blood pressure will drop. To prevent a blood pressure drop, it's good if they can drink half a liter to a liter of fluid of some sort before they get in the bath. That fills up their body fluid, the blood volume, prevents the blood pressure from dropping during the treatment. Most people probably don't need that, but some do, and it's nice just as a general precaution to do that initially. During the treatments, they can drink water, but be aware, if they drink the water, you need to wait a minute or two to take their temperature, because they drink cold water, put a thermometer in, it's going to read lower than it should. So you usually would take the temperature and then have them drink whatever water. You don't want the water real cold. You probably want it lukewarm, because that cold water can go inside and lower the body temperature, which is what you're trying to raise. Ice to the forehead. She'll usually have a bucket of ice water with 2 rags in it. You just pull one rag out, wring it out, put it on the forehead, and then in a minute or two you swap them. Take the other one out and put it on the forehead. And that's very comforting. And you try to help the patient get through the higher temperature, because it's uncomfortable, they want to get out. You try to encourage them to stay. You might sing hymns or tell them stories or something. But if they can stay for 20 minutes, that's ideal. And then when you pull them out, you can either wrap them in a wet sheet and lay them immediately on, we use a massage table with some towels on it. They lay on the towels, and then you put towels on top of them. You can put a wool blanket over them, and you keep them as warm as you can during that time. One of the difficulties with this form of treatment is when they're in the hot water bath, blood pressure can drop, and when you try to get them out of the bathtub, they're very weak, they're exhausted, they're lightheaded. You kind of have to be there holding them, make sure they don't pass out or faint or something like that. You help them out of the bath, and the problem is it may take a few minutes for them to come out of the bath, and during that time, the body temperature drops. So it's not an ideal solution. You do the best you can. You get them, and then you put them on the blankets, under the blankets, laying flat, put the wool blanket on top of them, and keep them that way for another 40 minutes. Most of the time, they'll go to sleep because it's exhausting. They're tired. That is what it is. People last night asked about fever treatments. They said, what about infrared? Can we use infrared sauna? We have experimented with infrared saunas. They will work. You can lay a patient flat and they have a tent going over them laying horizontally. The problem with the infrared sauna is that it takes about an hour to get their target temperature reached, because air has a lower specific heat. It takes longer to heat up the body. Water, on the other hand, we can usually get the temperature up to target in about 20 minutes. So it's less discomfort for the patient. They're in that fever bath shorter time, and with water than with an infrared sauna. And also in a lifestyle center where time is of essence, it's easier to get them in and out if you're doing the water baths rather than having to wait an hour with the infrared sauna. If you email me, I can send you what the protocol, the written protocol we use. It's in our cancer manual, and yeah, we can show you how to do that. What's that?
We've done it, but I just wanted you to explain it a little bit.
Okay.
Thank you.
Yeah, my pleasure. Sure. Any other questions? Or
She had a question back here.
The question back here? Yes, ma'am. What's that?
Hydrotherapy in this,
High,
hydrotherapy,
high, hot and cold therapy? Yeah, hot and cold therapy can increase the white blood cells. Sometimes after a fever treatment, you can do an ice rub, and that causes vasoconstriction. It's kind of like giving your blood vessels a workout. They relax, and then they tighten, they relax and tighten. That's what hot and cold can do. It can raise your white count, help you fight fevers, help you fight viruses or infections. We did, I think the first time I did hot and cold was at a lifestyle center up in Living Springs. I think that was the name of it. Anyway, it was up in Michigan, and it was February. And they asked me to come up and do the lifestyle session for them because their doctor, normally there, wasn't there that session. So I went up there in February, and they want you to walk with the patients. So I was walking with the patients. And when I went outside and walked with the patients, I realized why the doctor wasn't there. That's because it was February in Michigan, and it was cold. And so I started getting a viral syndrome. And I didn't tell anyone about this, but they said, oh, we've got this light box we just put together, and we want you to test it out. I said, oh, all right. So I got in, and I saw this box with light bulbs in it, and I thought, there's no way that this can be effective or do anything. But I got in the box, I sat down in it, and it's just a box, it's got around you, and it has a lid, and it comes around your neck, and they turn on the lights, but within about 5 or 10 minutes, I broke out in a sweat. It really did bring temperature, or at least my temperature up. And then after that, I was there for, 15 minutes or so. I got out, took a cold shower, and then went to bed. And the next day, my cold symptoms were gone. It was like night and day. You can use a hot shower or a fever bath as a treatment for the common cold. It's the best thing that we have, that I know of, for a common cold. And you can finish it off with the cold shower. Usually if you're doing the hot and cold, it's 3 minutes of a hot shower, 30 seconds of cold. I know at night I finish off with cold, and I count to 60, and I find that the colder it is, the faster I count. So, but anyway, that's kind of the goal. So, any other questions? Yes, ma'am.
So she's wondering, what about like a regular sauna use for inducing?
A regular sauna?
Yeah.
Like a steam sauna?
Yeah.
Yeah, those are good too, but again, they generally take an hour to get the temperature up. You can experiment with, if you have one, you can experiment. They are just as effective. It just takes longer, and the patient's experiencing that heat for a longer period of time. That's all. Yeah. Good questions. Any other? You got a question over here?
So my question is about the protocol for heat. You're saying that
What's that now?
For the water, that when you're in it, you said it's 20 minutes at the 100 and
It's 110 to 112.
And then 40 minutes outside, but you're keeping them warm?
Well, once your oral temperature is, say, maybe 103, you try to hold it in the bathtub for 20 minutes. So at the end of 20 minutes, it might go up to 103 or maybe even 104. It'll vary a bit. But when it hits 102 or 103, that's when you start your stopwatch. And you go for 20 minutes in the bathtub, and then at the end of 20 minutes, you come out of the bathtub, you lie them on a bed, and you wrap them up in blankets to keep them warm for another 40 minutes.
So that's where my question comes. Why the 40 minutes outside? If the
When
the patient can handle being
outside,
in for longer?
You can try keeping them in. They don't want to be there for more than 20. It's hard to keep them in 20 minutes.
So
it's
in-
uncomfortable.
It's not a
But-
medical reason to take them out. It's
Yeah.
because the patient's comfort reason.
If they want to stay in the tub, that's fine. You can keep them there a whole hour. Yeah. Yeah. Yeah, good questions. Any other questions? All righty. Well, thank you for coming. I've enjoyed talking with you. And if you ever have any concerns, I think my wife has cards. You can get in touch with us. We work at Hartland Institute. We also have up in Hagerstown, Maryland. If there's any way we can help you, we can email you things, whatever we can do. Be sure to let us know. This has been good talking with you. Thanks for coming.